right. So again, good evening, everybody. I'm really excited to see all of you, especially ang ating mga TFC subscribers dyan sa portal. Hello, hello, hello. Let's celebrate tonight because this is a last summary lecture and I believe tomorrow is the midterm exam. Lahat na ng lectures na panood natin, lahat na ng handout na basa natin, lahat na ng practice test 1 and 2 na sagutan natin for the midterms. Let's just enjoy and apply your knowledge. So we'll be having a different format for the summary lecture of this subject since I wanted to have you a sustained attention. We'll be tackling a lot of questions here na previously na-encounter ng maraming students in the board exam. And I'll be sharing some of my experiences also. All right, so let's begin with the first question. There. So stage of subclinical disease extending from the time of exposure to onset of disease. So we are now talking in the context of the natural history of disease. So you can chat your answer if you want to share it, but this time we're just going to review it and make sure na yung mga important concepts makover natin. So ang tamang sagot dito sa question na to is your incubation period. So bakit natin tinanong to? Kasi lagi nilang tinatanong sa board exam ito. And when we talk about incubation period, importante itong image na to that is included in your handout. Now when we talk about incubation period, remember, pwede siyang magkaroon ng permutation like the latent period. Ano ba yung difference ng incubation period sa latent period? When we talk about incubation period, we are pertaining to infectious diseases. Pero kapag latent period yung na-encounter nyo, it is pertaining to chronic diseases. So again, ang incubation period mo is under the subclinical disease. But you need to remember also yung different stages like the stage of susceptibility, clinical disease, and up to death. Now you need to remember to relate it to the levels of prevention. So remember, easily lang, no? Ang level of prevention, pag sinabi nating primary prevention, ang ating index case or ating population, wala pa silang sakit, wala pa silang outcome. Okay? And then for the secondary prevention, okay, usually it's asymptomatic under the latent period or under the incubation period. Kaya nga ang pinaka-common na tinatanong sa secondary prevention is your screening. And then for tertiary, we're just trying to prevent the progression or having the complication of a certain disease. And we'll be applying that more sa susunod na mga question. Next question natin is epidemiology topic. Okay, so sumagot tayo lahat. What term is used to describe a widespread outbreak of a disease that affects a large number of people within a population, community, or region? What's our answer there? Ayan, sige. Habang sinasagutan natin to, can I ask Dr. Mads Abraham to open cam and say hi to our students para na makita nila na kumpleto talaga ang pre-med team? Nandiyan ba si Doc Mads? Doc Ian, pwedeng naka-spotlight ba ako? Nandiyan na si Doc Mads. Ayan, sige.
Yes, Doc, naka-spotlight ka. Good evening, Doc Mads. Is she here? I don't see her.
Wala ba?
No, she's not here.
Okay, sige, sige. All right, so let's try to answer this. Ano yung mga sagot natin? So kung sinagot mo dito, epidemic disease, congratulations, tama ka. Okay, so kung narinig mo yung word na outbreak, okay, that is a similar definition. May outbreak tayo, may epidemic. Kaso ang pinagkaibahan lang nila, when we are talking about epidemic disease, we are dealing with a large geographical area of responsibility. So kapag sinabing community, region, a bigger population, much better isagot ang epidemic. Pero kung confined lang ang geographical area like a small barangay, a village, no, better to answer outbreak. Now let's discuss the different terminology here. When we talk about sporadic disease, all right, we are dealing with few and unrelated cases. So ayun yung sporadic natin, paminsan-minsan lang. Pag naman endemic, constant ang occurrence niyan, and usually mababa lang yung number of counts or frequency. Yung best example natin ng endemic, dalawa yan. In Palawan, we have malaria. And then in summer, everybody answer. All right, very good. It's your schistosomiasis. Ano naman ang hyperendemic? Hyperendemic refers to a persistent high levels of disease occurrence. And then, holoendemic, bago yan, for sure sa iba. Sinama ko talaga yan dahil ayan yung point ko ngayong summary lecture. Ano ba ang ibig sabihin ng holoendemic? Essentially, when every individual in the population is already affected or infected with the disease na in the context, no? So lahat affected na, that's your holoendemic. Next, this is a nice question. And background lang para sa ating mga students. May nagtanong kasi previously, no, sa top-notch team, Doc, naglalabas po ba ang board exam ng pictures and graphs? And I will say, yes. Specifically, nung board exam ko, naglabas sila ng image and graph. No? This is the exact image na linabas nila. Kaya na-identify ko na they are using the CDC epidemiology kasi galing yun doon. Okay? Now, ang challenge dito is, alam na natin yung definition ng prevalence and incidence, correct? Simply, ang prevalence is the number of old and new cases. Incidence, the number of new cases. What if we are going to apply that knowledge in a graph? So ito na yon. Please take note. Okay? So what is the prevalence of disease during July in a population of 700 people? So what's our answer here? Let's go back to the definition. Prevalence, number of new and old cases. So the answer here is 8/700. Doc, bakit? Again, we're just going to count all of the cases, old and new, in July. So ito yung mga old cases natin from July, 1, 2, and 3. Tapos yung mga new cases natin, ito, 1, 2, 3, 4, 5. So we have a total of 8 cases. Kaya ayun naging prevalence. Eh kung babaguhin ko yung tanong, same image pa din, same graph pa din, pero itinatanong na incidence. What's your answer? So you just count the new cases in the month of July, which is 1, 2, 3, 4, and 5. So ang answer for incidence is 5/700. So ang pinaka-moral lesson natin dito sa slide na to, know how to interpret graphs and images at baka maglabas ng images. Okay? Doc Ian, if they have questions sa chat box, please guide me kasi I'm currently sharing my screen. Wala akong access.
All right, Doc. I think they're trying to answer your questions.
All right.
Answer sila dito.
All right. So another image here, another interpretation. So for distribution A, you can conclude that. So we are now talking about the normal distribution curve, the bell curve. Other term ng ating normal distribution curve is the Gaussian curve or Gaussian curve. So when you see an image like this, since nasa handout nyo na yung ating skew distribution, try to identify first, ano ba tong image na to? This is negatively skewed or skewed to the left. What is the interpretation of that? If we have a skewed to the left, meaning we have an outlier that is it small or big outlier? Very good. Kapag skewed to the left, you have a small outlier. Remember, in graph interpretation, starting from the left side, ang starting count natin here is 0. And pagpapunta na tayo sa right side, mas tumataas yung ating value. Kaya kapag skewed to the left siya, ang ating outlying values are small. Siyempre, malaki. Now, with that definition, the best answer here is that your mean is less than the median, less than the mode. Let's try to dissect that further. So this is a normally distributed curve. Kaya nga siya tinawag na bell curve kasi you will appreciate here the shape of a bell curve. Kapag normally distributed, tandaan nyo, ang mode is equal to mean, equal to median. That is your normally distributed curve. Now, kapag skewed to the left, ito yung nasa case natin, lagi nyo tatandaan na ang median ay laging nasa gitna. So kapag mababa ang outlying value mo, o ang outlying value mo is small, ang magiging average mo will be small, correct? Kaya yung mean mo will be less than your median. And then your mode is the most frequently observed data, so that is your mode. Okay, so ang skewed to the right mo, again, also known as your positively skewed, outlying values mo malaki. So ibig sabihin, kung ang outlier mo malaki, what would be the effect to the average or mean? Lalaki din. Kaya ang interpretation mo kapag skewed to the right, your mean is more than your median and more than your mode. So that's how you interpret your distribution curve. Now let's talk about your levels of prevention, which is an example of tertiary prevention. Okay. Sige, para doon sa mga hindi pa kabisado yung meaning. Kapag tertiary prevention po, Doc, ibig sabihin, you are trying to prevent the progression of the disease or trying to prevent the complication that might happen in a certain disease process. So with that definition, the best answer here is occupational therapy after a stroke. Why? Because you are trying to prevent the complication of stroke through giving occupational therapy. Dok, bakit mali yung letter E, hospice care? Guys, ang hospice care or end-of-life palliative care is not part of the level of preventions already. Remember, diniscuss yan ni Dr. De La Rosa, na ang hospice care is the end of the line. You are just trying to give comfort to the terminally ill patient. And we are not trying to prevent any complication na because that's the end of the line. That is your hospice care. Ngayon, ang post-exposure prophylaxis for rabies, ano sa tingin niyo ang level of prevention niyan? Take note, this is not pre-exposure, post-exposure, meaning nakagat ka na ng aso and you are thinking na baka magka-rabies ka. So with that, we are thinking about the latency period. We are in the stage of the subclinical disease. So ang post-exposure prophylaxis for rabies is secondary prevention because we are preventing the possible contraction of rabies. Yung treatment of essential hypertension. Treatment of essential hypertension. Ang best dyan is your secondary level of prevention. Well, some will argue that dapat primary yan, pero for this case, let's go back to the definition na kapag essential hypertension, you already have the disease process. Kasi ang rule natin with the primary is wala muna siya dapat disease, no? Wala pang outcome. Ang nasal steroid is a primary prevention because the word itself, to prevent rebound congestion. Now, best here is primary prevention. Let's move on to the next question. Under what circumstances can primary and tertiary prevention of medical disease most obviously be achieved concurrently in different individuals through the treatment of one patient? Sige, I'll give you time to read. Para doon sa mga hirap, ano daw yung isang action na pwedeng tertiary prevention at the same time, primary na nagagawa. All right. So the answer here is when a patient is treated for active tuberculosis. So the management of your communicable diseases like your tuberculosis offers a unique opportunity for prevention. Why? We all know that your tuberculosis is hyper-endemic here in the Philippines, right? So when a patient with active disease or active, nakakahawa, and when we treat your active tuberculosis and we try to prevent the progression and the impairment of that patient, anong level of prevention yon? Ay, galing, very good. That's your tertiary prevention. But remember, at the same time, when we're trying to treat the patient, we are trying to spread the disease of that patient, diba? Kasi nga hindi na siya nakakahawa. And that is a form of primary prevention. Remember, diba? Sabi nga natin sa mga pasyente natin, for the first 2 weeks, after 2 weeks of your medication ng anti-TB meds, hindi ka na nakakahawa. So remember, treating tuberculosis is both tertiary and primary prevention. Now let's move on to your family principle, types of family. Let's try to identify the family structure given in this scenario. Nami is a widower from East Blue. She has a son named Sorrow. After 5 years of being single, she decided to marry Luffy, a divorcee from Ayala, Alabang. He has 3 kids. What's her answer here? Anong family structure to? The Straw Hat family. Ay, hindi. Hindi rin to One Piece family. Sample lang. Very easy lang tong question na to ha. The correct answer is blended. So when we talk about blended, this is just the combination of your step-parents and stepchildren. So si Nami may anak, si Luffy may anak, nag-asawa sila, edi blended family. Remember your extended family ha. This is extension, depende. Pwedeng unilateral extension, pwedeng maternal or paternal side lang, or bilateral extension. Happy family na. Sinama yung lola kay papa, lolo kay mama. So that's your bilateral family extension. Your single parent family, this is very easy, no? Pwedeng hiwalay ka, like yung mga single mom with 2 kids, single parent yon. Pero tandaan nyo to ha, everybody listen to this kasi ito yung lagi nalilito. Doc, ano pong masasabi nyo sa family structure ng isang nanay na may 2 anak, magkasama sila sa isang bahay, pero hindi naman po hiwalay sa asawa, nag-a-abroad lang po yung tatay sa Saudi. Ano kaya sa tingin nyo yung family structure nun? Yes, that is your single parent family. Kahit nakasal siya, wala silang pinag-aawayan, the fact na malayo yung isa sa mag-asawa, that is already a single parent family. Nuclear, this is your basic, consists of your parents, I mean the mother, the father, and the children. Communal, natanong na rin to previously, this is a grouping of individual formed for specific ideological or societal purpose. Kaya nga 'di ba merong SM family, your Jollibee family, ito rin our top-notch family because we have a one societal purpose right now and that is to pass the board exam which is malapit na. Okay, let's move on to your occupational hazard. Jollibee is a meat slicer from SNR Alabang. He was rushed to the hospital because of an injury involving his right index finger. Upon examination, the finger was hanging only by the skin. Also, it was reported that he was drunk while at work. Given this scenario, which hazard control protocol will be best to prevent this kind of injury? So go back to your hierarchy of occupational hazard. So the answer here is he should follow the policy of no drinking of alcohol at the workplace. Kasi ito yung pinaka-related doon sa case. And you know na lasing siya pumasok, kailangan niya sumunod sa ating policy. Now, relating that, what is the type of hazard control employed if Jollibee followed the no drinking policy at work? This is very easy. Sige. Yung mga nasa Zoom natin, try nyo sumagot actively para talagang matest yung inyong knowledge. Yung mga nasa portal natin, you try to answer it in actively. Alright? So ano ba yung mga no drinking policy at work? That is your administrative control. Diba? Ano ba yung administrative control? That's how you change the way people work in a certain company. And then this is related to your work practice, control or changes in how the work procedure is done. Ito yung mga policies, supervision, okay? So nagkakaroon na kasi ng trend ngayon na pumapasok na rin yung occupational health no, sa ating board exam. Now let's try to review the hierarchy of risk control measure. And this is standard sa lahat ng industries. So from the bottom of the inverted pyramid, we have here the PPE. And this is the less effective, pataas doon sa inverted pyramid natin, more effective siya. Ang pinaka-effective sa lahat is elimination. You physically remove the hazard. But in reality, mahirap gawin yan, mag-eliminate, no? Kasi lagi namang may hazard sa lahat ng ginagawa natin. Next to that is your substitution. You replace the hazard. Okay? Mahirap din gawin yan. Pero ang most commonly employed control of measure when it comes to occupational medicine is your engineering control, where you isolate the workers from the hazard. Okay? Engineering control also is the installment no, of facilities in order to protect the worker. And then we have the administrative control, which I discussed earlier, and lastly your PPE, no, protective, personal protective equipment. This is not just applicable to the hospital setting like wearing the gloves, goggles, hairnet, no, sa trabaho din, like in the construction industry, like your boots, okay, and then in the welding company, like yung ating mask. So remember that. Okay, let's go to your type of research study designs. So this is the case. A group of patients with lung cancer is matched to a group of patients without lung cancer. Their smoking habits over the course of their lives is compared. On the basis of this information, researchers compute the rate of lung cancer in patients who smoke versus those who never smoke. This is an example of what? Study. All right, mabilis sumasagot ang ating mga students. Very good. Mukhang master na nila itong mga study designs. Again, kung nanood ka ng aking video lecture under epidemiology, I gave a certain ample amount of time for you to understand this. Ano ba yung starting point ng case natin? Okay, so naggrupo tayo ng mga pasyenteng may lung cancer. Okay, that is your case. Tapos, naggrupo tayo ng mga pasyenteng walang lung cancer. And what do you call that? What nomenclature? That is your control. And then sunundan nyo, ang starting point nito ay outcome. And then you look for the association of your exposure. So best answer here is your case control. Remember, in case control study, diba, usually we are working against the time, no, when it comes to the direction of inquiry. Ang starting point natin is grouping yung mga population with the disease, and that's, we define it cases. And then the population without the disease control. And then we look for the exposure. So, ang starting point neto usually kapag case control, your outcome then to exposure. Ito ang ating clincher question sa mga kababayan. Dapat with feelings. What is the inferential statistics used in case control? Yan, sige. Kahit magmukha kang tanga sa katabi mo, magsalita ka, ilabas mo yan. Very good. It's your odds ratio. Okay, that's your inferential statistics. Nako, high yield yan. Hindi ka nag-prevmed kung hindi mo alam yan. Let's move on to your disability. Heidelin loses vision because of bilateral retinal detachment after an encounter with Nesty. Luckily, there are braille in the elevator, so he has no problem getting around. What is the condition of Heidelin? Is it impairment, disability, impairment and disability, handicap, or yung tatlong components na yan? Meron si Heidelin. Sagot-sagot na. Very good. So if you answered A and B, that is the correct answer. Doc, why? Nako, lagi itong china-challenge yung tanong na to. Well, sa case natin, hindi na mawawala ang impairment ni Heidelin because meron na siyang loss of physiological function ng kanyang eyes. Nagkaroon na nga siya ng bilateral retinal detachment. And going back to the handout, ang definition ng impairment natin is abnormality or loss of physiological function. Now, bakit doc disability din? When we talk about disability, dapat yung mga normal na ginagawa ng whole population, nagagawa ng isang tao. Okay? So since si Heidelin, no, I mean ito, for example, ako, normally, kapag sasakay ako ng elevator, pipindutin ko lang yung switch, okay na ako. Pipiliin ko yung floor, okay na ako. Okay? Pero si Heidelin kasi, okay, since meron kang braille, okay, wait, so si Heidelin, so since meron presence of braille, assisted si Heidelin at nagagawa na yon. But the thing is, hindi iyon yung normal na ginagawa ng normal population. Kaya siya disability. Doc, bakit wala siyang handicap? Kasi yung handicap, ayun yung hindi mo na nagagawa or there's a prevention of the fulfillment of your action. And in this case, ang action lang naman ni Heidelin ay sumakay ng elevator. Nagawa niya pa rin yun. Kaya hindi siya handicap. Yes, impaired siya. Yes, may disability siya. Pero hindi siya handicap kasi at the end of the day, nagagawa niya pa rin sumakay ng elevator. Alright? So remember your impairment, disability, and handicap. Ang impairment organ, anatomical level. Ang disability mo, no, more of the performance. Ang handicap naman, societal ang application.
Doc, sorry. Can I interrupt if there's a question?
Yeah, sure.
Okay, so one of the students asked, "Hi Doc, clarification for this question. Bakit hindi po yung elimination of the meat grinder based po sa reverse pyramid sabi elimination is the most effective and the question ina-ask po most effective?"
Yeah. So ang gusto niya, ang dapat dito ang sagot, we are pertaining with this question, right?
I guess so.
Well, kasi ganito yon. Yung explain ko kanina, no guys, sinabi ko, di ba, sa tunay na buhay, in reality, hindi talaga applicable na alisin natin yung meat slicer. Kasi kung mawawala yung meat slicer, wala nang magagawang trabaho. So, yes, elimination kung kaya, pero in reality, especially in the industry of service, we cannot do that because we cannot perform our task anymore. Okay? So, ayun yung reason doon.
And then another question, Doc. Sorry. Good evening, Doc. Regarding the Jollibee SNR finger injury, wouldn't replacing the machine with an automatic letter D, nalimutan ko na po yung exact wording, be considered an engineering control which is superior to an administrative control? Thank you po.
All right. Okay. I get your point. Kumbaga, if you're referring to the inverted pyramid alone, dapat nga naman engineering control. Pero again, the reason why I constructed this question like this, because you need to be responsive to the question. Kasi sa board exam, kailangan nakakalimutan ng mga estudyante mag-relate sa question. Bakit ba kailangan sumunod siya sa policy? You go back to the cause and effect, the problem tree analysis. What is the root cause? Bakit ba nagkaroon ng naputol yung index finger ni Jollibee? Kasi pumasok siya ng lasing. So we need to be responsive to the question. But I do understand. I agree na engineering control is much higher than your admin control. But go back, be responsive to the question. Go back to the case. Thank you, Doc Ian. Magandang tanong yun. Actually, ayun yung point ko kung ba't ginawa ko yung question na yun. You need to be responsive to the question. So let's move on. So far, na-address naman in real time. Ayan. So let's talk about your bias. Sarah P undergoes a screening test and a tumor was discovered. The screening advanced the time of diagnosis, but no true prolongation of life occurs because there are no effective treatments available. What form of bias is this? Very good, everyone. This is your lead time bias, and this is best explained by this image. So I'll be showing you two graphs here. One at the top, this is your lead time bias. One in the bottom, this is your length bias. Ang lead time bias kasi, guys, in reality, ang screening, problematic din yan, okay? Yung screen ka ng screen, over-screening will just give you harm rather than help when it comes to dealing with certain disease process. So dito kasi, imagine this first line is patient A and then the second line here is patient B. Si patient A, meron siyang capacity to do early screening. Si patient B, wala siyang capacity to do early screening. So si patient A, since nagkaroon siya ng early screening, doon niya nalaman, doon sa screening procedure na yon na may cancer siya. Alright? So yun, meron siyang lead time of knowing that he or she has cancer. But on patient B naman, nalaman niya lang na may cancer siya kasi nandun na siya sa part ng clinical disease, sa history of disease, no? Symptomatic na siya, kaya nalaman niyang cancer siya. Now, comparing the both cases, sino yung parang may mas mahaba ang survival time? Pipiliin nyo si patient A. But in reality, this is just a perceived survival time. Nalaman niya lang ng mas maaga na may cancer siya, pero at the end of the day, sabay silang namatay. And that is your lead time bias. Pinaasa ka lang ng screening na akala mo, magsusurvive ako, hahaba buhay ko. Pero ang totoo lang, much mas maaga mo lang nalaman na ikaw ay may cancer. Versus your length bias, no, marami ring nalilito dito, pero sa case natin sa exam, kapag binigyan kayo ng case ng indolent and aggressive cancer at kung gaano kabilis ang presentation ng symptomatology, doon nyo malalaman na it's a case of length bias. Okay? Ito kasi yung point. If you have an aggressive cancer, hindi naaabot sa point na may screening time ka kasi aggressive nga siya. Ibig sabihin, symptomatic ka na kagad. Malalaman mo na may cancer ka. Versus doon sa may mga indolent cancer or less aggressive cancer, you have time to do screening. Okay? And then, since nalaman mo may screening ka, inisip mo na yung screening na yon yung nagpahaba ng buhay mo. But in reality, kaya lang naman humaba ang buhay mo versus doon kay aggressive cancer kasi yung cancer mo is less aggressive. And that is your length bias. So please don't forget that. Maraming nalilito dito. Okay, let's move on to the scales of measurement of data. The place of birth is an example of what? Measurement scale. Place of birth. Actual board exam question. Yes, very good. Straight recall. This is your nominal type of data. And when we are talking about dichotomous, there are only two possible values. Most commonly, male, female, dead, alive, cured, not cured. Okay, so that is your dichotomous. Your ordinal is intrinsically ordered. Again, order ang ordinal, but not in a quantitative way. Meaning, if there's a count, that is not a real count. Okay, ang example ng order nyo, good, better, best, always, sometimes, never. Ang interval nyo, there's a real numerical units, but your zero there has a arbitrary definition. Walang clear 0 point. For example, best example ko dito, temperature. Pag sinabi nating temperature, may real numerical unit siya. Okay, 0, tama. Pero yung temperature kasi natin, may mga different metric measurement. Pag ba sinabi kong 0 degree Celsius, magiging 0 Fahrenheit siya or 0 Kelvin? Hindi, di ba? Kaya siya interval. Ibig sabihin, tandaan mo to, ang 0 point mo is arbitrary. There's no clear 0 point. But when we talk about ratio, measurements in relation to the 0 is clear. 0 is not arbitrary. Meaning, kapag ako ay 0, sabihin na natin, kapag 0 ako, alam mo na yung 0 na yon is clear. Okay? So, for example, 0 meter, alam mo na 0 sa centimeters yon. Alam mo na 0 sa millimeters yon. So, there's a clear point 0. Very good. So the blood type is what kind of measurement scale? This time, we're going to mix and match. Kasi tinatanong to, 2 steps recall. Very good. Okay, it's your qualitative nominal. So remember, ang moral lesson natin sa slide na to, you know how to categorize your data kung siya ay quantitative or qualitative. So hindi ka doon titigil. Dapat alam mo i-categorize kung yung quantitative mo ay interval or ratio at alam mo i-categorize ang qualitative mo if it's nominal, categorical. Alright? Tinatanong yan. Next question tayo. Which of the following is a sensitive indicator of the standard of healthcare by analyzing the number of deaths over 50 years old? We are now talking about vital statistics. What's our answer here? Mabilis. Nako, very good. Favorite nila to. Na-emphasize ko to sa lecture. It's your Swarups index. Okay? So this is part of your vital statistics. And later on, we'll discuss yung mga iba. Yung child mortality rate, maternal mortality rate, and dependency ratio. Again, kanina sa clarification in dependency ratio, it's a formula. You follow the formula, which is 15 to 64. Okay? Pero this time, it's your Swarups index. So what is the numerator number for your Swarups? It's the number of deaths among those 50 years and older in a calendar year. What is the denominator? Total deaths in a year. Remember the factor or the K, 100. Okay? O next tayo. Definition naman ito ng precision and accuracy. In a study of a novel antihypertensive drug, The experimental group had a mean systolic blood pressure of 123, 125, 124 respectively on a 3 separate measurement. The mean now was 124. Which of the following statements below best describe the situation? So this time, application lang ng knowledge nyo in accuracy and precision. Very good. The answer here is the measurements are precise and accurate. Going back to our definition, when we talk about precision, it's how close the measurement of the same item. Malamang, same measurement ng BP, and how close yung mga measurement na yon to each other. That is your precision. Magkakadikit naman, di ba? 123, 125, 124. Actually, kapag ginawa mo yan sa bullseye, magkakadikit sila. Now, ang accuracy naman is the closeness of each measurement or the computed value to its true value. Meaning, yung iyong mean, itong mga individual measurement nyo, they are close to the true value or mean. Kaya yung statement na ito ay precise and accurate. Let's go to the walang kamatayang formula for sensitivity. And this is a previous board exam question. Tinatanong lang nila simply, what is the formula of sensitivity? And ito lang yon, yung mga choices na yon. So dapat by heart, alam mo na. Pero ako, minsan, ang trick ko dyan, para hindi ako malitot, wala akong active memorization, dinodrawing ko na yan or sinusulat ko na yan sa ating mahiwagang 2x2 table. Okay? So this is just simply a simple recall question. This is your true positive over the sum of true positive plus false negative. Now, para sa mga first-timer, mga ngayon pa lang nakita ang ating 2x2 table, okay? At kumakapit lang sa summary lecture, nako, mag-video lecture at handout kayo. Pero this is your 2x2 table. In your 2x2 table, okay, remember on the left side, usually dito natin dinalagay yung ating exposure or yung ating screening. And on the top side naman, dito yung ating disease status. Starting muna doon sa positive or with the disease or with the outcome. And then doon sa second naman, yung walang outcome or yung walang disease. Okay? So itututok nyo lang yan. Positive, positive. Diba? That is your true positive. In some cases, ang ginagamit sa exam, instead of your TP, ang ginagamit is the cell letter, which is your A. So pwedeng ang maging permutation nito ng sensitivity formula nyo is A over the sum of A plus C. But it's just the same. Binigyan lang ng definition yung true positive, false negative, etc. Now, that's the form, that's how you follow your 2x2 table. False positive meaning you are positive in the screening, but in reality, you don't have the disease. And by the way, guys, tinanong na rin yung individual definition ng true positive, false positive. Kaya sa handout nyo, nasa yellow box yan. Pero this time, makinig na muna sa akin para ma-master nyo na ang konseptong ito. Kapag ikaw ay negative sa screening at wala ka naman at ikaw ay may sakit talaga or you have the outcome, you are false negative. And if you don't have the outcome or the disease and you are negative, true negative talaga yon. And how do we approach this 2x2 table? Ayun lang ba yung matutulong sa'yo? Hindi. Paano kung narin nakalimutan mo yung formula? You just follow yung ating horizontal analysis and vertical analysis. Look, your sensitivity is from your vertical analysis. Okay? So tignan nyo, follow the arrow pababa. So it's your true positive over true positive plus Fn. Ang inyong specificity naman, vertical pa din pero pataas. Your true negative over the sum of true negative plus false positive. Bakit tinawag kong vertical analysis, horizontal analysis, yung positive predictive value and negative predictive value? Kasi nga, itong line na to, yung axis na to, yung solution line natin. So positive predictive value is TP over TP plus FP, and then yung inyong NPV ay pabalik. Your TN over the sum of TN plus FN. So again, ang tip ko sa inyo kapag nasa 12 subject na kayo, last day of the board exam, pag binigay na yung inyong test paper, isulat nyo na kagad yung 2x2 table plus the formula para nagre-refer na lang kayo. Okay? Pwede naman kasing sulatan ng ang ating questioning. Next question, let's talk about sampling. High yield sa board exam ang non-probability sampling at probability sampling. Kaya this time, dapat alam mo kung ano yung non-probability sa probability. So what sampling method is employed when households are selected at random and every person in each household is included in the sample? This is the common case of your cluster sampling. Ibig sabihin, kapag cluster sampling, guys, gumawa ka ng clusters mo. At kung ano man yung, kung sino man yung nandoon na element sa loob ng cluster nyo, included na sila sa participants. Okay? So when we talk about elements, ito yung mga individual participants in a study. Okay? Ano naman yung difference niya sa stratified? Parehas may grupo. Ginrupo mo, ginrupo mo. Sa cluster, ginrupo mo, pero kasama yung buong grupo. Itong stratified, naggrupo ka, pero kada grupo, isa lang ang kukunin mo. That is your stratified sampling. Ang systematic sampling, from the word sistema, may sistema ka because you usually start at random and then you will compute for the interval and look for the factor. Ang simple random sampling, guys, ang other term niyan ay your fishbowl method. Simple lang. Okay? Pero dito sa SRS nyo, lahat ay may equal chance of mabunot. Okay? Kaya nga dito, sa simple random sampling, pag nag-fishbowl method kayo, pag nabunot mo na yon, usually binabalik ulit yon para lahat may equal chance pa rin. Kaya kung mabunot mo siya, ibalik mo pa din, included siya sa participants, hanggang sa bumunot ka ng bumunot, makompleto mo kung ilan yung gusto mong participants. Pero at this slide, kaya ko to linagay dito kasi nga, I want to have an emphasis on the difference of your cluster sampling and your stratified sampling. So again, going back to the definition, the population is first divided into sampling units. Ang tawag mo doon, clusters. Okay? And then, there will be a sample of clusters that will be selected. And every element found in each cluster is included in the study, okay, versus your stratified na in every sample of strata, one participant per element only. Now let's go to your different types of your graph. Okay, so which graph is suitable to be used to show the increasing cases of dengue from 2009 to 2023? Previous case din ito sa exam. Binigyan ka ng time element. Kapag may nakita kang time element and there is a temporal relationship at yung may increasing and decreasing cases, ang best answer is everyone answer. O yung iba hindi sumasagot, naghihintay na lang ng tamang sagot. Sumagot kayo, guys, sayang yung opportunity. Active learning tayo. Very good. Your line graph. Okay? Frequency polygon is just a comparison of two lines. Your pie chart, diba? That's a proportion. And usually the total percentage of a pie chart is 100%. No? Dapat matandaan nyo rin yung pie chart, yung rules on how to develop a pie chart. Okay, for example, yung kanyang clockwise presentation, usually dapat ang ating number of variables here, iba-iba to sa literature, do not quote me on this ha, hindi to strict. Yung iba ang gusto less than 5 categories or variables, yung iba hanggang 7, 9. Okay, pero importante, when you are trying to use a pie chart, konti lang yung number of variables or categories nyo. Okay? Next question, laging tinatanong, most common measure of central tendency, yung iba kasi nakakalimutan. This is your mean. This is the most common measure of your central tendency. Pero paano do, kunwari tinanong, common measure of central tendency, walang mean, ang nandoon average. Average po ba isasagot ko? Malamang, no, kasi nga, we can use that interchangeably, mean and average. Let's go to your type of statistics. What statistical tests should be used in comparing the serum cholesterol levels of patients before and after intake of a new lipid-lowering drug agent? This is very easy. Ang ating keyword here, keywords is your before and after, but you only have one intervention. And this is your paired t-test. Your ANOVA is analysis of variance. Usually you're having more than two population group. Chi-square is just a comparison of two categorical variable. And then usually itong mga example na pinakita ko sa inyo, these are parametric tests. When we say parametric tests, assuming that it is targeted to the whole population. Non-parametric, usually small ang number of population yan. Okay? So this is your table of your commonly used statistical tests. I know it's quite intimidating, but I just want you to focus more on the parametric tests kasi ayan yung applicable sa healthcare researches. Okay, kasi nga naman kapag gumamit ka ng population na malaki, it is parametric. Let's go to the part of vital statistics. Recall, laging lumalabas, what is the most sensitive index in assessing health status of the community? Nako, recall. Yung mga hindi nakasagot nito, kabahang ka, aralin mo to, importante to. Alright, so the correct answer here is your infant mortality rate. Tandaan nyo yan. No? That is the most sensitive index in assessing health status. Why? Because your infant is the most vulnerable group when it comes to your vital statistics. And syempre, kung meron kang poor health status, sila yung pinaka-magsasuffer. Now, let's try to compute everybody. I won't read the question. I'll let you read the question. I'll give you a minute to answer this. I-practice lang natin. Ilabas nyo na yung mga calculator nyo. By this time, dapat meron na kayong allowed calculator na pinescribe ng TRC para napapractice nyo na yan. Ha? Dapat yung mga calculator nyo praktisado rin, hindi yung bago. Tip ko din sa inyo, may nangyari na before. Bumili ng bagong calculator. Dinala sa board exam. Pagkabukas, walang battery be. Ano na? I-check nyo. Sige. Story time ako habang nag-a-answer kayo ha. Walang battery ang calculator. Meron namang nagdala calculator. Yung calculator ng palengke, yung malaki. So kada compute niya may tunog. Tut, tut, tut. Nakautang na loob. Magdala kayo ng walang tunog para hindi kayo makaistorbo. Okay? At saka baka kabahan yung iba, ba't gumagamit ka ng calculator na may tunog? Eh wala namang computation. Totoo. Ayan. Sige, this is just a sample computation based from maternal mortality rate. So hopefully meron na kayong answer. Sige, I'll be checking the participants here. Heart react muna yung mga nakapag-compute na. Yung mga nakapag-heart react, automatic pasa na kayo sa board exam. O, di ba? Ang bilis. Ayan tayo sa mga nagre-review sa board exam, very superstitious. O, tignan mo, tumataas ang aking heart reacts. Ayan. Sige, congrats. Pasa ka na sa boards. So what's the answer here? This is your maternal mortality rate, specifically your sepsis, and the formula is maternal mortality due to sepsis. And based from our case, there are 30 cases of sepsis. What's the denominator for this case? It's the maternal mortality due to all causes. Now, based from our case, we have 30 sepsis, death, and then we have total of 200 mortality of mothers, maternal mortality. So simple math, use your calculator, 30 over 200, you will get 15%. So if you answered B here, congratulations. Practice lang ng practice. Let's talk about the concept of prevalence. Kanina, yung application natin ng prevalence is through graph. Ngayon naman, ang application natin ng prevalence is through wordings. All of the following increases prevalence rate except sumagot ka. Ayan. Oh, wow, may heart pa din talaga. Ayan. Kada heart plus 1 sa PrevMed. Oh, ayan. Ako talaga naman superstitious. I-bless natin kayo. Ayan. Sige. Virtual blessing. So here, except high case fatality rate, no? Talaga namang in-explain ko ito ng mabuti sa aking video lecture. When you have a longer duration of illness, mas matagal ang chance mo na mabilang ka sa isang prevalence survey, correct? Kaya the longer the illness, the higher the chance na ikaw ay masasama pa sa survey. Second, if there are increasing number of new cases or there is new incidences of a certain disease, then tataas talaga ang prevalence. Kapag maganda ang case finding, improve ang diagnostic facilities, nakakapag-diagnose ka ng mga diseases, tataas ang prevalence rate. Never tataas ang prevalence rate kung namamatay na ang mga cases, correct? Kasi nga, kapag nag-survey ka, hindi mo na sila mabibilang or hindi na sila included sa count. So here, the correct answer is high case fatality rate. Now let's move on to the basic epidemiologic framework. Epidemiological concept stating that the effects never depend on a single isolated cause, but rather each link is the result of a complex genealogy and antecedents. Nako, in-explain ko to ng mabuti. Recall lang to. At kapag ang sinagot mo ay web position, tama ka do, congratulations. Pero kailangan nating reviewin ang epidemiological triad. Everybody say, ano ba ang ating elements or component of your triad in epidemiology? It is what is our mnemonic here? It's our HEA. HEA, it's your host, environment, and your agent. Now, your lever or balance also deals with the elements or triad. But this time, ano yung fulcrum? Ano yung fulcrum sa lever or balance? Very good. It's your environment. And if there will be a disequilibrium in that seesaw because of the fulcrum, tumaas si host, bumaba si agent, there will be a disease. And then we have the will. The will is somehow similar to the other concept, pero ang will nyo, meron siyang different environment. And in the middle, you have the core, the host. Diba? You have the outer environment that you need to remember. Ano yung three subcomponents na yon? Na environmental component, okay, then we have here your social component, and then your biological component. So balikan ng handout kung nalilito pa. Next question refers to the constant presence of a very high incidence of disease infection. Previous board exam question. Very high. Persistent. That is your hyperendemic. So do not be confused with endemic. Okay? So ang clarifier, ang qualifying word natin dan, if the number of cases or the frequency is persistent or very high based from the baseline. Let's go to the study design.
Doc, we have questions lang, sorry.
Yes.
Good evening, Doc. Maki-ask lang kay Dr. Man regarding sa sample question po about levels of prevention. Pa-clarify lang po ulit, bakit both primary and tertiary prevention po ang treatment of active TB? And is it not also a secondary level po? And may rationale po ba why other choices were not correct? Thank you po, Doc.
All right. Hopefully, nakinig ka kanina and then we will just clarify it. Based on the choices kasi, ang available lang doon is primary. Ang tinatanong lang naman natin is primary and tertiary. Pero bakit dinagpasan natin, Doc? Bakit hindi kasama yung secondary level prevention? Again, remember, kapag ginamot natin ang isang active tuberculosis patient, meaning siya ay nakakahawa. Sa konteksto ng index patient o ng pasyente, kapag ginamot mo siya, okay, hindi mo na mape-prevent natin yung progression ng tuberculosis. That is tertiary, di ba? Kasi ang definition natin, progression of complication. Hindi naman rehab ang ginawa natin. Ginamot natin, binigyan natin ng anti-TB meds. So gumaling. So hindi na nag-progress, hindi na nag-complicate. Tertiary. Bakit siya primary? Ang primary kasi, in the context of the whole community or population, wala pang sakit, okay, yung community. Bakit siya primary? Kasi nga, pinigilan mo na siya ay makahawa ng ibang pasyente or nung taong nakapaligid sa kanya. Now, why not secondary? Secondary kasi is more of screening. Ang naging intervention lang natin is treatment. Okay? So ang best answer pa din talaga is primary and tertiary. And I do appreciate your question, Doc, kasi marami talagang nalilito doon. Pero I want you to appreciate that you need to be responsive with the case na kaya siya tertiary and primary lang kasi ayun lang yung applicable doon sa context ni pasyente. Wala tayong ginawang screening and hindi naman natin kailangan mag-screening sa mga pasyente na clinical na. Kasi it doesn't make sense. Why would you screen someone na you know na positive dun sa disease? Hopefully, maintindihan natin yon.
Doc, meron pa tayong isang question. Pa-clarify po, Doc, yung question na may sagot na cluster. Hindi po ba stratified yon? Thanks po. Pa-enlighten and pa-clear na lang po, Doc. Thank you po.
Alright, so I'll repeat it again. This time, I'll try to annotate, okay? Para maintindihan natin. Where is the draw here? Okay. So ang cluster sampling kasi is gumawa ka ng different groups of groups. For example, ang ginamit doon, different household daw. Ayan daw yung ginawa nila. Okay? So sabihin natin guys, tayo ay researcher sa isang barangay. Okay? Doon sa isang barangay na yon, madaming bahay. Ayan, triangle na lang ha kasi bumabagal ako. So nagkaroon tayo ng random selection of the household. And alam naman natin guys, di ba sa household may nakatira. Depende kung ilan, nanay, tatay, kapatid, kuya, lola. Okay, so sa cluster sampling, kinonsider mo yung isang bahay as a cluster. At sa cluster sampling, kapag randomly nakapag-select ka na ng household, which is a cluster, lahat ng nakatira doon or the elements inside of that household is already included in your participants. Versus sa stratified, okay, sabihin na natin, itong mga household, ginawa natin silang strata, grupo pa din, grupo. Pero randomly na-select mo tong bahay na to. Dito, sa strata na to, isa lang ang pipiliin mo at hindi lahat. So ang difference doon is the inclusion of the elements. Cluster, sa isang household, lahat. Pag strata, sa isang household, isa lang, stratified. Okay? Sige. Clear tayo doon ha? Okay lang yan. Thank you for that question. Hopefully yung iba natuto with that question. Okay, let's try to answer this. Let's move on. Study design that assigns, manipulates a patient's environment is what type of study design? Okay, heart react para sa mga tapos na. Nakikinig pa ba tayo dyan, mga ka-heart react? Ayan, ang mga maka-heart react ngayon, makaka 200 plus sa midterms. The correct answer here is, yan, di na siya gumana. Bakit? Ayan, clinical trial. The fact na there's a manipulation, this is already a trial. Okay, remember that your cohort, there's no manipulation of patient. Simply, we are just observing them. Okay, actually sa cohort, di ba, we start with the exposure and then we follow until they develop a outcome. Alam din natin ang cohort, two types yan, retrospective and prospective. Ang cross-sectional mo, we don't manipulate patient again. We only assign them. Assign them whether they have the disease. And when they have the disease, they are called the cases. When they don't have the disease, they are called control. Okay, cross-sectional, the other term here is your prevalence survey. Depende kung analytical study, kung descriptive survey. Ano ang best keyword natin or buzzword natin sa cross-sectional or prevalence? It is a snapshot of time. Next question tayo. A study enrolled 355 participants in a dedicated weight loss clinic and tracked their health annually. Track health annually for an average of 4 years to see whether there's an effect in reduction in atrial fibrillation burden and severity. What is the study design? Oh, hanapin ang keyword. Yung ating mga portal students, please pay attention. Okay. So kung ang sinagot mo dito ay cohort, very good. Kasi nga naman yung keyword natin ay nag-track sinundan for 4 years. Okay. And just to check your knowledge, anong type of ano to? Cohort. Kung susundan. It's your prospective type of cohort. Very good. Now, your meta-analysis, para lang ma-share ko sa inyo, tinatanong din yan sometimes, okay, that is your most powerful. No? When we go to the EBM or evidence-based medicine pyramid, it is on top of the pyramid. Meta-analysis, higher ang kanyang power, lesser ang kanyang bias. Now, this is just a difference showing you the study design or methodology of your cohort and case control. Paulit-ulit tayo. Kapag ang case mo, ang starting point lagi ay exposure, tapos susundan over time or binalikan at nagkaroon ng development ng outcome, that is your cohort. At ang iyong case control, pag ang starting point niya lagi is the outcome, at sinundan, relate, in-associate kung ano yung mga exposure na nag-cause but nagkaroon siya ng outcome, that is your case control. And tandaan mo ngayon, uulitin ko ang aking mnemonic, kapag inferential statistic of study, it's your, what's the inferential statistic? Everybody say, very good, relative risk, okay? And then when you say case control, what's the inferential statistic? It's your odds ratio. Alright? Sige. Very good tayo dyan. Ngayon, pag-usapan naman natin ang cycle of behavioral changes. Changes of behavior. In counseling a patient in smoking cessation, the patient answers, I don't think smoking half a pack a day can do so much harm. After all, I'm already 75 and I've done it for the past 25 years. Which among the following is the patient currently in terms of capacity for change in behavior? Ito naging naging favorite na rin to, not just in the board exam but also in family medicine residency. So what do you think is the answer here? For sure, yung iba dyan nalito, sinagot contemplation. But the best answer is pre-contemplation. Go back to your handout or listen to me. When we say pre-contemplation, they're not even thinking about changing anything from their behavior. There's an active sign of resistance. Okay? Ngayon guys, ang challenging kapag family principles ang tanong, kailangan bumalik ka doon sa stem, sa kaso. Okay? Aralin mo, basahin mo, read in between the lines pa nga eh. Basta itry mo i-visualize yung case para hindi ka manilitaw. So this is the ating cycle of behavioral changes. Again, pre-contemplation, the patient usually has no intention in changing his or her behavior. And then sa contemplation, ang magbabago lang dito is aware na siya that there is a problem, pero wala siyang planong gawin yon. Actually, yung mga doctors usually stuck at contemplation because we all know, no? For example, yung mga ibang naninigarilyo dyan, aware naman akong problema siya pero hindi ko kaya. Yung mga lasinggera dyan, aware naman ako pero hindi ko kaya. Okay, and then you have the preparation, you now have the intention of taking the action to address the problem. And then when you do something for that problem, then that's the action already. Now, when you reach something and you will try to maintain the change of behavior, that is what you call the maintenance. And then relapse, balik ka sa dati mong behavior. But remember, this is the clincher. Every time na ikaw ay nag-relapse, do not consider that as a failure. Actually, you learn something from that relapse. And the next time na ikaw ay dadaan sa cycle, you will not encounter that same problem that you had before. Okay? So that's the cycle. Let's move on to the family life cycle. A family consists of the mother, the father with 3 children. The eldest is a medical student, age 22. The middle child is age 17, taking up an undergraduate degree while the youngest sibling is 9 in primary school. Ano ang stage ng pamilya na to? Common mistakes of the students here. They're trying to make the case na buhay nila. They're imagining na sila yan. Hindi porket ikaw ay may nabasang medical student, pipiliin mo na yung case dito according to your life cycle. No. Okay? You choose according sa case. And for sure, yung iba sa inyo, sasagutin is launching family. But for this case, it's family with adolescents. Kasi yung medical student na yan, hindi pa siya nalo-launch. It's not part of the description. Now, if you're having difficulty here, I'll leave you time. No, later, balikan nyo yung life cycle. Pero bigyan nyo siya ng oras because it's really important. Okay, impact of illness naman tayo. Patient was discharged from hospitalization after having a stroke, which left him with residual left-sided weakness. He is regularly being seen by his physician for follow-up, compliant sa gamot, nag-a-attend ng regular physical therapy. What stage is he in the family illness trajectory? Very good. It's your early adjustment to outcome. Yung iba, no, sa impact, nalilito sila sa onset of illness to diagnosis tsaka impact phase. Kapag doon sa case, nagsimula na doon sa diagnosis, na-diagnose na, wag na kayo sumagot ng onset of illness to diagnosis. Doon na kayo sa impact phase. Kunwari, a patient consulted a physician and the physician reported that the patient have stage 4 cancer, has stage 4 cancer. Hindi na yun onset of illness to diagnosis. That is already impact phase. Kasi an onset of illness prior to having a consult to a doctor. Ha? Sakit ko rin yan dati. Lagi ako nalilito. So huwag kayong malilito dyan sa impact of illness. So again, these are the different stages ng impact natin. We have the onset of illness, then impact phase, okay, and then major therapeutic efforts. Ito, kaya ito nakabold kasi ito yung laging tinatanong. This is the most challenging and rewarding stage, not for the patient, but for the physician. Okay, then early adjustment to outcome, and then lastly, adjustment to the permanency of the outcome. Let's talk about your genogram. Very easy, baka lang malito. The following are true about constructing a genogram except your index patient marked with a triangle. This is wrong. Why? Why? Sagot sa sarili. Hindi ka pa rin sumasagot. Sumagot ka. Ayan. Index patient marked dapat with an arrow and not a triangle. Arrow dapat yan. Now, when you construct a genogram, it's important you have 3 generations, starting from the grandparents, the parents, and the offsprings. Ang firstborn mo should be farthest from the left. Again, pinaka-left. The way I interpret this, yung firstborn sa pinaka-left siya. Okay? Hindi yan farthest sa left na nasa right na siya. Nasa left yan. And then, syempre, kailangan lagyan mo ng family name above each main family. And then, usually, dinalagay din sa genogram yung date kung kailan siya ginawa para every time na sine-check mo yung genogram na yon, nalalaman mo kung ilang taon na yung mga patient, yung family members and the index patient. Okay? Let's talk about your family assessment tools. Nako, hate na hate ko to kasi litong-lito ako. Pero hopefully, makuha nyo sila. Family assessment tools used to assess the capacity to participate in provision of healthcare, cope with crisis. Provision of healthcare. Kaya ba nilang mag-provide sa family member nila may sakit, especially when there's a crisis? Ngayon, kung crisis lang yung naging point of recall mo, mali yan, ha? Kailangan tandaan mo na ang screen natin, not just with the crisis, hindi, kasi ang mnemonic ko dito dati, mnemonic, ano ba? When there's a crisis, what will you do? You scream. Pero, it's more of the provision of healthcare. So let's have a review. Baka naman puro kayo scream, pero hindi nyo alam kung ano yung inclusion ng acronym ng SCREEM. Everybody ready? O, pay attention na muna. Let's try to identify yung acronym ng SCREAM. Beginning with letter S. This is, very good, social. How about C? Okay, cultural. Next, R. Okay, religious. And then E, we have economic. E, another E, educational. And lastly, M, medical. Okay? Again, ang family genogram natin, it's a graphic representation. Kapag ginamit yung family tree, nako, genogram na yan. Nag-display din siya ng relationship among individuals. And then your APGAR, it's a 5-item questionnaire. Okay? Usually, we measure the satisfaction with family relationship. Ano yung APGAR na yan? Hindi yan yung APGAR ng baby, ha? Family APGAR yan. Hindi yan appearance. Okay, hindi yan pulse, hindi yan grimace. Your A is your adaptation. P for partnership. G for growth. Okay, then affect. Then R for resolve. Your Minition family map, okay, this is your Minition family map shows the family dynamics, okay, of the family members inside of it. Doon sa dinrowing nyo sa circle. Next tool. Measures one level of satisfaction with family relationship usually needed when family will be directly involved in caring for the patient. The correct answer here is, na-explain ko na kanina, your family APGAR. Sige nga guys, what is the maximum score that you can give in APGAR? Sige, chat nyo nga. Ayan, very good. Minimum. Minimum na pwede nyo ibigay na score sa APGAR. O sige, sa GCS, Glasgow Coma Scoring, ano ang maximum na pwede nyo ibigay? Okay, very good. Sige, 3 ang minimum sa GCS. Alright. Sige, next, which of the following is not included in the expanded newborn screening? Ano ang hindi kasama? Nako, ang daming sumasagot ng cystic fibrosis. Naka-red na nga yung expanded. Expanded to, hindi lang po yung basic na expanded, ibig sabihin lahat-lahat na. The correct answer here is not included ang hypothyroidism. Why? Why? Bakit hindi kasamang hypothyroidism? Kasi you need to qualify it. It should be, bakit lumipad? Wait. It should be congenital hypothyroidism. Very good. Okay, so we have here phenylketonuria, congenital hypothyroidism, then your adrenal hyper or hypoplasia. Is it hyper or hypoplasia? Okay, hypo. And then we have your G6PD. And then you have your, what's the last one? Yung hindi ko nabanggit. Okay. Now here, ang previously na tinanong din, ano daw yung recently in-include sa newborn screening nung 2012. Nako, previous boards yan. So kung yan, nako, lahat very good. Na parang nanood ng video. It's your maple syrup urine disease or MSUD. Okay? Tapos tinanong din, what's the Republic Act as the newborn screening? Sagot, type nyo, sabihin nyo, what's the Republic Act? 9288. Okay. Sige, happy na ako sa newborn screening.
Doc, sorry. We have a question here. Male is dapat daw po nasa left sa genogram. Eldest is also sa leftmost. Paano po if the eldest is a female?
Ay, no. It doesn't matter kung sino yung pinakapanganay. Kung
Okay.
babae man yan o lalaki, siya yung pinaka nasa left. Nagkakaroon lang ng problem kasi kung yung panganay mo, babae, tapos may asawang lalaki. So, mangyayari, ililink mo siya, yung male sa left. Okay? Male yung positioning nung square. Pero kapag siblings, order of siblings, kasi hodang babae, lalaki yan, kung sino yung panganay, siya yung pinaka-left or babae man siya. Okay?
Okay. Next question, Doc. Good evening. Can I ask po, Doc Louis Man, the difference of stage 4 early adjustment from adjustment for permanency stage 5 in relation po to the case previously? Thank you po, Doc.
Alright. When we talk about adjustment, if the, syempre contextualize sa case. Pag for example, nasa last part na siya ng illness, permanent na talaga. Okay, pilay na siya forever. That is already permanent. Kapag early adjustment, ayun yung early diagnosis mo ng cases na alam mo ring na debilitating. Okay? So, lagi lang, alam ko there's a fine line. Okay? Pero, kapag inintindi mo na nandun na siya sa talagang permanent, wala ka nang magagawa. For example, lumpo, naputol ang paa, nabulag, okay, na stroke, bedridden, permanent na yon. Pag early adjustment, more of the initial diagnosis of a case that you know that will be debilitating. Okay? Oh, and then, ayan, si Doc MM, meron din siya doon, usually stage 4 is post-hospitalization after major therapy. Ayun. Thank you, Doc MM. Ayan, nag-monitor na ako ng chat. Sorry, ito, this presents fundamental strategies and approaches for health promotion. Si Doc Abraham, okay, Ottawa Charter. Okay, with the participants considered vital for major progress. Sorry, this is just a simple recall. Kapag di mo alam, hindi mo alam. Kaya ang moral lesson, kahit dinaanan mo lang sa handout, go ahead, daanan mo lang. Basta mabasa mo, malaman mo na may Ottawa Charter. Your alma ata declaration, that is anchored to your primary health care. Okay, let's talk about health promotion strategies. Formation of neighborhood walking clubs to combat hypertension and high cholesterol is what form of health promotion strategy? Another concept na kapag hindi mo alam, di mo alam. The correct answer here is social. Okay? Kasi nga naman, you have a neighborhood walking clubs. Pag educational, more of you teach educational programs, organizational, you're organizing, for example, annual hearing and vision screening in schools, legislative, just go straightforward. Okay? Yung mga policies, laws, social, yung mga formation of groups, economic, one that is related to businesses that offers protection, health promotion strategies. Regulation aimed at reducing youth access to tobacco products and alcohol is what kind of health promotion strategy? Nako, nasabi ko na kanina. It's your legislative health promotion strategy. Very good. Mabilis kayo sumagot siya. Konti na lang guys. Matatapos na tayo. Na-cover na natin lahat ng pinaka-importanting konsepto. Eto, paulit po. Ay, bilis naman. Wala pa ang question. May sagot na. Everybody, gayahin ako. Ability of an agent to produce serious illness measured in terms of fatality is your virulence. Very good. Now, which of the following intervention is the most effective in prevention and control of injuries, especially in the workplace? O, ito na. Guys, bigyan ko na kayo ng chance. Wala na po siyang case. So, ibig sabihin kung ano na po yung pinaka-effective. Ito na po yung pinaka-effective. This is your, wag mo ako sasabihin ng elimination dito. Nako ha, doc elimination po. Again, be responsive to the question. Wala sa choices yon. Your engineering control. Now, going back kanina doon kay Jollibee, si Jollibee kasi may case. So, respond to the case. Pero pag walang case, you answer na kung ano yung pinaka-highest. Recall, which among the following is true regarding UN Sustainable Development Goals? Is it 15 goals, 17 goals, 13 goals? Very good. Your SDGs are your 17 goals to be achieved over the next 15 years. And actually, malapit na siya, 2030. Ilan ang MDGs nyo? Ilan ang Millennium Development Goals? Very good. It's your 8. 126 yung MDGs, may nakakatakot na yon. Ang dami. Okay, now we are talking about Millennium Development Goal. Ano dito yung hindi nag-involve ng maternal health care? Kasi lahat kayo for sure ang alam nyo, maternal health care lang. Pero ano yung hindi involve ang maternal health care? It's your 7. And what is 7? 7 is ensure environmental sustainability. Yung 1, of course, poverty and hunger related to maternal health care also. Okay, gender equality, empower women. And syempre yung number 5, improve maternal health. We are nearing the end of our summary lecture. Congratulations, konting tiis na lang. All of the following are part of the Millennium Development Goals except Very good. Mabilis kayo lahat sumagot. This is a recall, universal healthcare. Meron akong additional question. What is the Republic Act for your UHC law? Everybody say 1, 1, 2, 2, 3. Very good. That's your RA 1, 1, 2, 2, 3. Which among the following vaccine is not part of the EPI program of the Department of Health? And ngayon ay National Immunization Program or NIP. Ano ang hindi kasama sa NIP or EPI? Very good. It's your hepatitis A. Kasi nga naman ang hepatitis A, di mo na kailangan ng bakuna, kumain ka lang sa labas. O, joke lang yun ha. Baka maniwala, maging patola. Okay, hindi. Joke lang yun. Pero ang hepatitis A, it's not included in your NIP, but it is recommended. Okay, that's part of the vaccination strategy, but not included in your NIP. Okay, your Hib, varicella, mumps, and BCG is included. Now let's talk about the immunization. Definition of a fully immunized child before 1 year old, before 1, again, before 1 or before 12 months must be given except, very good, your MMR. Kasi yung iba, hindi marunong mag-comprehend. Bakit? Guys, eto na, story time na naman tayo bago ako magpaalam. The preventive medicine and public health is the 12th subject of the board exam. This is done on the 4th day of the exam. And I swear you, pangako, pag-apat na subject, ay pag-last na subject mo na, pang-apat na araw mo na pagod ka na. Nung first day, ang dami mong kaba, ang dami mong takot. Takot kang mag-shade, takot kang sumagot, takot kang magkamali. Pag dumating yung pang-apat na araw, mawawala na lahat ng takot mo, especially pag hapon na, pregnant na, kasi ang nangingibabaw na lang sa'yo pagod. Okay? So please, wag kang magpapatalo doon sa mentality na yon. You take your last exam seriously. Wag ka sumagot ng isang beses mo lang binasa at di mo naiintindihan. Tutukan mo pa din, lagyan mo pa din ng sipag. Kaya dapat ngayon pa lang may mindset ka na pagdating ng 4th day, it's like my first day. Ganun ako kaseryoso, ganun ako katutok. Okay? So here again, your MMR. O sige, bilang chikahan na tayo, ano ba ang measles? Kailan binibigay yan? Everybody type or answer. Okay. Ang kaso, sinabi may epidemic, may outbreak. Very good. Mabilis ang usapan natin. When there's an outbreak, you can give your measles as early as 6 months. Let's try to test your comprehension this time. Pagalingan magbasa kasi pagod ka na, pang last question mo na. The following are signs of dengue with warning signs except your thrombocytosis. Why? It should be thrombocytopenia. And based on the warning signs of dengue, okay, may budget tayo, may ano tayo, may pa-highlight at may ayan, malaki ba? Nakikita niyo ba yung lumaki? Yeah, may budget tayo, lumalaki. Ayan, so warning signs, abdominal pain or tenderness. Guys, marami nalilito dito ha. Persistent vomiting. Persistent. Vomiting alone, hindi yan warning sign. Dapat tuloy-tuloy na pagsuka. Clinical fluid accumulation, mucosal bleed, lethargy or restlessness, hindi yan additional. Liver enlargement of 2, more than 2. Hindi siya more than 2 or equal. More than 2 centimeters. Anong ibig sabihin nun? 3 centimeters ang liver enlargement. Laboratory natin, increase in hematocrit. Concurrent now, partner dapat to. Increase ang hematocrit with rapid decrease in platelet count. And your thrombocytosis is increase ang platelet count. So thrombocytopenia. Okay, so nako, high yield yung warning signs na yan. Not just in preventive medicine, but also in pediatrics and internal medicine. Now, I think this is my last question, just to emphasize the importance of rabies here in the Philippines. All of the following are considered under category 2 bite, except, yes, feel good question, para feeling mo naman tama ang last question, tama ang sagot mo sa last question. This is a minor abrasion on the face. Kasi even though it's a minor abrasion on the face, Once na nasa mukha ang iyong exposure, automatic, it is category 3. So that's the end of my summary lecture. Hopefully, na-inspire ko kayo to study more.
Yeah, Doc, sorry, we have questions from the MGs, no? From other classes. Doc, after ng summary lecture po, Doc, can I ask po to have more examples regarding this Pearson R linear regression and multiple regression? Thank you po, Doc.
All right, sure. I'll help, pero I will also ask Mavi to focus on that. You can send all of your questions naman. Since we are already running out of time, and I don't want to overextend it kasi may QM pa kayo with Dr. Mavi and Dr. De La Rosa. I'll give them more time. Pero we will entertain all of your questions. Don't worry. Hindi pa po tapos ang ating PrevMed. Bukas pa po ang aming opisina para sa inyong lahat. And again, sorry, nasira yung line of thought ko sa aking ending slide, Doc Ian.
Sorry.
nawala yung pamaalaala mo kaya akong version ni Tita Charo. OMG. Stop share tayo. Ayan. So again, ano ba? And again, the end is near. Kumanta na lang my way. Galingan nyo pa, sipagan nyo pa. This is only the first time that you'll be reading the handout. So don't expect that you already know it. This is not yet the mastery period. We're giving you a lot of time to master it. Just appreciate on how we approach kung paano natin sinagot yung questions. Dapat ma-mimic nyo or matry nyo yung level of attack natin sa questions. And again guys, yung mga questions na yan, yung ibang pangalan, binago lang namin, pero yung konsepto, ayun na ayon yung lumalabas sa board exam. So kung ikaw ay nakakasagot ng tama sa mga tanong natin sa summary lecture, ibig sabihin you're on the right track. Ayan yung lalabas, ganyan yung lalabas sa board exam. Okay? So PrevMed is anything under the sun. PrevMed is hard. PrevMed is walang kwenta. PrevMed hindi patok. PrevMed walang patapon. It's on your mentality. And again, we are given a lot of time to study. We have 5 years of medical education. Use that. Comprehension, tapang, and again, bad trip ka na kasi pag 4th day. Pagod ka na kasi. Minsan, isipin mo naman, give PrevMed a chance. No? Sabi nga ni Bea kay Popoy, ako na lang ulit. So, good luck sa inyo and pa-screenshot, pa-group picture muna tayong lahat because we have Dr. Abraham here to say hi. Kompleto kaming PrevMed team. Do we have Dr. Virata pa? Ayan, open cam everybody. Thank you so much. I'm done with the summary.
Good evening, everyone.
Ayan. Paano kami, ayan, pasama si Doc Broly, si Doc Virata.
Wait, nag-on din ng camera yung mga students.
Ay, wag na mag-on yung camera yung mga students for data privacy reasons.
The teachers
okay,
lang, guys.
Teachers lang, teachers.
Turn off muna kayo ng camera, sorry.
Ngayon lang nandito yung, okay
Wait lang.
Fans Ian
Spotlight. Wait lang, guys.
Well, you can open the camera. Pero get the picture lang muna, Ian, of the teachers.
Okay, sige. Smile.
For data privacy reasons.
Okay, 1, 2, 3, smile. Alright.
Kompleto, PrevMed team. Thank you so much.
Maraming salamat to the PrevMed team. Very good work. Louie, Mads, Mavi, and Michael. Okay? Guys, ni-reshoot nila yung mga videos ninyo very near the start date. Okay? Ni-revamp nila lahat. So I appreciate the effort. I think it was much better. Okay? And you're going to give the students a very good chance of getting a good score for this subject. Thank you so much. Okay? Next, Ian.